Welcome to the Wild Physio podcast with your host, Andrew Wild. Today, I have Daniel Arbilla on. Daniel is an accredited exercise physiologist and mentor to health and fitness professionals around the world looking to upskill in communication skills and chronic pain. Daniel is passionate about guiding and coaching health and fitness professionals through challenging cases and to assist them in implementing evidence-based care and psychologically informed practice. Daniel and I have been friends for a few years now, since coming across each other via social media, I think it was, and it's a big welcome to Daniel. Thank you for coming on, mate.
It's an absolute pleasure. Thank you for having me.
First thing, let's dive into this one. How is an exercise physiologist different to a physiotherapist and different to a personal trainer?
It's a tough one. So I'll go with the standard answer, and then I'll get a bit controversial because I know you love that controversy.
Oh, mate, love it. Bring it.
The idea is we go through 4 years of university and we're specialized in anything chronic. So we're looking at more of the lifestyle diseases. So the story that I was told, it's not verified, but to have to double check my sources, was that the kind of morbidity, mortality rates of diabetes, heart disease, and all the non-communicable diseases over time in Australia was rising and rising. And it seemed as though we needed some profession to bridge that gap and to help everyone there in terms of preventative medicine. And that's where EP came along. It stemmed away from physiotherapy, which was heading towards more of the modality route this was back in TENS days and ultrasound and all the other fancy gadgets. And then, so exercise physiologists were born out of that, and we're specialized in anything that has to do with lifestyle, counseling, behavior change. So chronic pain is in there, but there is a lot of overlap. So I see it as kind of Venn diagrams where physio would be more specialized in the acute care, and then they can absolutely get into the late stage. And then EPs start from more of that moderate to late stage of care and into more of the lifestyle change. So looking at exercise, prescription, exercise as medicine for the holistic benefits, not just for specifically, say, musculoskeletal impairments. So that's the standard one.
Yeah.
You want the controversial one now?
Good answer, but yeah, I'd love to hear the controversial one.
Yeah. The idea is if we're looking at the same evidence base, if we're looking at helping humans and we're being person-centered, why are we modality-centered? Why are we profession-centered? If I'm looking at someone and they have certain goals that they want to hit, and I'm looking at the whole person, if we're all going by the same evidence base, why would a chiro treat any differently from an osteo, treat any differently from a physio, treat any differently from a personal trainer, treat any differently from an EP? Respecting scope of practice, respecting, we can't do hands-on therapies, respecting I can't give a specific diagnosis. After that's done, shouldn't we be doing what, maybe what the client wants, not what we want?
Yeah, I completely agree. And I think even on my previous podcast, the Hybrid Therapist podcast, we actually started off calling it the Hybrid Physio podcast, and then we rebranded to the Hybrid Therapist podcast because we said the same thing. All health professionals across the board, including, you said it yourself, chiro, osteo, physio, EPs, we really should be using the available evidence, being evidence-led and using our own practical experience and our past experiences to make a judgment on what should be done. And often it should be done based around what the client wants and what the expectations and goals are that the client has. So yeah, I completely agree. I think it should be more, and that's why we rebranded to the therapist, because it should be sort of rehabilitation therapist should be the overlying sort of principle behind all of these professions. And we all should do similar things, really. Would you agree?
Absolutely. And we have a lot of scope for learning and expanding our skills outside of university. So it's not like we go through 4 years of formal education and that's it. We're stuck with what we learned. We can still venture out within our scope of practice to learn more about S&C, to learn more about early stage rehab, for EPs to work with physios and to learn more about their processes, and physios to do the same with the lifestyle counseling, with the motivational interviewing skills. We can all learn from each other as long as we're being person-centered. I don't see that there to be too much difference. I know chiros that know more about S&C than EPs. I know osteos that are really good at motivational interviewing, compared to an EP. So that's just my take.
Yeah, oh, mate, I love what you stand for, and it's really good to see, because I think that a lot of physios are a little bit territorial in a way, that they think, oh, this is my realm. You shouldn't be delving into my realm. You know, don't stand on my turf. And I think a lot of physios could learn. Well, I know that they could learn a lot from exercise physiologists, but they could learn a lot from strength and conditioning coaches. So I completely agree. I feel like it should be more of a well-rounded approach across the board with all different professions. Now, Daniel posts a lot of great stuff on social media, especially your Facebook. I think your Facebook's amazing. You repost a lot of things that a lot of big names in the health profession really advocate. And you're often seen as a manual therapy hater, much like me. A lot of people think I hate manual therapy, and it really grinds my gears that they think that. I'm not a manual therapy hater. I just don't like the fact that people are only given passive modalities when they see a health professional, and that should never be done. So why do you think people perceive you as a manual therapy hater? And while you're there, why should we use manual therapy?
It's a great question. And it's so true that people would take from the content that they see, they see it through their own lens. And especially if, which is totally common, and I do it myself, if I'm attached to a certain modality, to a certain way of practice, if someone calls out that treatment, that modality, it's like they're calling me out.
Yeah.
Personally. So it's like, once we attach our identity to our practice, it will be so much harder to separate ourselves to then take things objectively and learn in the process. So totally understand that I can be seen as someone who just hates all manual therapy. So to steel man it, to go back and say, okay, what are all the benefits and when is it helpful? So I'm looking at things from a lens now of what is the purpose of this intervention for this person in their context. So we can criticize exercise just the same. What is the purpose of specific glute activations for someone with chronic low back pain that just needs to do gardening? Probably not so indicated, hey? And we can see that with anything. If we're using manual therapy as a way to get someone to calm the system down, to get them in a relaxed state of mind, to get them lying down after a hugely stressful workplace situation, away from kids and other stresses in their life, this is an excuse for them to actually like get some stress relief. It feels good for them. It provides an avenue for opening up and being vulnerable and getting some trust now with their therapist. I see it as a hugely influential context now to then start exploring things, to then feel safe enough to be like, oh, all we did was move. I just moved you really gently, passively in this way. And it actually felt a lot better. What do you take from that? Because all I did was apply a little bit of pressure. All I did was touch you in this specific way. And how can you do that yourself now? How can we then bridge you from where you are now to not needing to see anyone ever again and to get back into your life? So I see it's more the mindset going into it versus the intervention itself. There's a really great paper out by Jason Silvernail and Diane Jacobs of looking at the therapist as an operator or an interactor. So we can see manual therapy through the lens of, I'm fixing your tissues. I am providing you the pain relief that you need before you load. What message does that send about exercise then? That it's pain inducing?
Yeah.
That it's bad for you? Like, so these are the things that we need to take a step back and look at objectively and look at the whole picture. What are the messages that we're sending? And absolutely, we can use manual therapy in an interactor model where we're questioning things, where we're doing a back and forth, we're asking what feels good to you? What do you think that you need? How about if we tried this less invasive intervention? If we go from a specific modality, say a needle cupping and really deep tissue massage, to something minimal, takes just 5 minutes, and we give you the same symptomatic relief, what does that tell you? So I can see it as a very easy way for someone to feel safe, to explore different avenues and to bridge the gap from the passive the needing that passive therapy to move to then just moving from the start.
Yeah, and I think you are very much like me. You think the same way in that regard. The fact that it can be used, there should never be a focus on it. It's often at the start of a journey with a client, and you'll wean them off it very quickly. And I assume that's how you roll with it as well.
Yeah, absolutely. And quick caveat, as an exercise physiologist, it's not within my scope of practice to apply manual therapy. In terms of what I do, I definitely do use touch. I definitely can still do orthopedic assessments, mostly just to reassure them that nothing's broken.
Yeah,
Because when they get to me, it's not an acute, mechanism of injury. I would be sending them off to someone like you, a physio for an assessment. But if someone just feels like something's off, and I can just show them that it's actually they're safe to move and they're pretty strong, and I do a Lachlan's test and put it in the face and be like, oh, like I'm really pulling hard, and it's like, fuck, that knee's strong. Shit. So then they feel reassured by that. But I can't use specific interventions to provide, say, a symptomatic change or relief. So I see hands and the power of touch as super important. I see it as a way to build rapport and trust, especially now with, our society doesn't touch at all really with COVID. So if we can provide that safety with our hands, with our guidance, with some hands-on coaching, if everything is, safe
consented
to do so, consented as well, absolutely. Then yeah, absolutely. I see it as a vehicle, as a powerful way to get someone to the next level of rehab, which is going away from that, from the necessity of the passive intervention.
Yeah, and it's pulling away from relying on the clinician to help and putting the power back into the client's hand. I think that's so important. And it's a narrative that not enough health professionals are using. And you said it yourself, even when you said, oh, look, if we did some massage in clinic with someone or something like that, and then you said, oh, well, if that client went home, how do they do that at home? There's definitely ways that we can, and tools we can give a client to give them tolerating strategies and things like that. And I talk about that a lot. Tolerating strategies is so good because you're effectively giving them those tools via what you do in clinic, and then say, okay, you can do some of this stuff at home yourself, or get one of your friends or your family to help you a little bit if you need. Now, this leads me into this question. So do you think that physios, well, I'll put it this way, the frustration you have with physiotherapists and other health professionals, the fact that they rely on passive treatments too much, why do you get so frustrated with these clinicians? Because I know I do, and it frustrates the hell out of me because I see it so often. People come to me and it's kind of like a final resort. They've seen 3 or 4 physios, and those physios or those osteos or chiros, they've only done passive modalities. They haven't focused on the strength and conditioning side of things or the pain education, the things that we should be sort of focusing on. Why do you get so frustrated? And also, how do you deal with it?
Great question. So why do I get frustrated? I tend to see people that have failed that route. So I see people that think that they need to be released before they can get under a bar. I see people that think there's something intrinsically, inherently wrong with their shoulder, and they're pointing to it all the time. They're already applying their own manual therapy. That type of person that's hyper vigilant already to the pain in their shoulder, and they've gotten treatment specific to their shoulder that they've forgotten life.
Yeah.
They've forgotten how to get back into activities. They never experienced that, hey, you can have a little bit of pain as long as it's tolerable, and we can get back into your meaningful activities. We can get back into your goals through a graded exposure, through progressive overload. It's the same thing within the context of this person. So I get frustrated that they haven't even had the opportunity to practice and experience that they can move, they can load, they can exercise with some symptoms. And you know what happens after that? They get better. So they've never experienced that symptom modification, neuromodulation, whatever term you want to use, pain relief, with movement. with exercise-induced hyperalgesia. And the reason that that's valuable is because they don't need me for that. They can just do that by themselves. And if we're looking at trying to build and empower, build self-efficacy, build self-management, and we're looking at reducing overall burden to the healthcare system, welcome to one of the best forms, which is movement. Let's introduce it early. So I see people that just get, the worried well. There's no real clear mechanism of injury. They go and see a therapist, and the therapist automatically goes into their systemized way of thinking, which is 2 weeks of passive. Then we can get some light loads for 4 weeks. Then we can look at loading them. Fuck that. Just get them under a bar from the start if they're comfortable with it. If they give your consent, how much money did they just save? How much time did they just save from the healthcare system? There's so many other benefits that I can see that people are missing out on that. That's what really frustrates me.
Yeah, I completely agree. And, like if I see a client for the first time and they've only had that passive type of treatment in the past, it is quite tricky because obviously you need to get them on board, and you may need to do some passive work to make sure that they don't think that you're a complete idiot. And, you effectively just slowly massage them into, okay, this guy knows what he's talking about. And also we're starting to just slowly filter in some more exercise, strength and conditioning principles. And then slowly we wean off the passive modalities and do less and less of them. And look, I would probably do less than 5 to 8 minutes probably per session, no matter who it is. And I've weaned them off and they haven't even realized a lot of the time. And they're getting symptom change and they're feeling much better. Their pain levels are reducing, and then that's where the magic happens. I think I said it was one of my posts last week, a quote of mine. We need to make sure these people realize these people that are injured, they realize that they're not broken. Because I think that a lot of physios, chiros, osteos, other health professionals make people feel like they're broken, make them feel like this is a life sentence. They're not going to get through this without the help of my hands for the rest of your life, and it's not the way forward. And a lot of people are worse off by going and seeing a health professional that tells them stuff like that than they would be if they just let it settle. The natural history of the injury takes time and it just settles in time. So I think that it can often be detrimental to a client's long-term success if they go and see a clinician that tells them that stuff, and it really pisses me off. And hence why I'm so passionate about it, and so are you. So props to you for making the world a better place, because you really are. And you're one of these guys you're on Facebook and Instagram and you're trying your best to get the message across, much like me. So congrats to you, because I think it's a really, really important message. Because the easy way out for a physio, EP, chiro, whoever, is to take that route of, yeah, I can do the passive for the first few weeks because it's easy. You don't even need to think. You just do that and then away they go. They keep coming back. It's good for quote unquote business. But the thing is, you're taking them for a ride, aren't you?
That's it. It makes sense though. So if we're in that context where, say, okay, we're working in private practice, all our colleagues practice this way, where we would be, like I mentioned, 2 weeks of passive therapy to calm symptoms down. Then there's a system of gradually loading. So all our colleagues are doing it. We're seeing results. So we're within our confirmation bias. We're only seeing the people that like us and that stay along the ride. Then the message that people are getting is that they need it for 2 weeks first. So it's just a cycle. It's great business model. Absolutely.
It definitely is a good business model for that person that comes in, and, they get maybe 6 appointments out of them prior to them even doing any exercise. It's good in that regard. But I think the big thing is a lot of physios and other health professionals are missing the point. If you do a good job with someone, they're going to refer 4, 5, 6 people to you. And I've got people that refer me 10 people a year or more. And it's because I do a good job, not because I've done heaps of passive stuff with them. I've just focused on that. And then eventually after 3 months, they're no better and they haven't referred me anyone. So I think a lot of people think about it too blinkered. And it's like the short term. I need to make sure that the next 3 weeks of my business or the next 3 weeks, my calendar is full of clients, rather than being like, okay, in 12 months, what type of clinician do I want to be? And what type of client do I want to have? Would you agree with that? I think that short term versus long term, the mindset is really damaging.
Absolutely. So what you touched on is, who do we want to be? What kind of person do we want to, what kind of clinician do we want to be like? How do we want to practice? What reputation are we looking to build? If we're already complaining that everyone is expecting passive therapy and manual therapy and it's really difficult to get them to exercise, it fucking makes sense if we do that for 2 weeks with everyone, because we're building that reputation. All their, the patients that we see, the clients that we see, they're telling their friends and family, hey, this person is really great with their hands. So that's the expectation that we're building, and we're not looking at the long term. We're not looking at, the people that we really want to help. Maybe there's a niche in there. Maybe there's a target market that we want to pursue. So what are the long-term gains and goals versus the immediate KPIs within the next 4 weeks? I think that's so crucial.
Yeah. And even the notion of KPIs at a physio practice really have annoyed me over the years, when prior to me owning and running a business, working in a clinic and not seeing clients enough in the first 2 weeks, and getting into trouble because a client's come in and they've got back pain and I haven't seen them 3 times in the first week. I'm like, well, but why? They didn't need to. They only needed to see me that once, and then maybe one more the following week. And then we move it to every fortnight, and wean them off even further from there. And it used to really annoy me. I'm like, KPIs are, yeah, I get it. It's a business thing. But at the same time, if someone comes in with a broken finger or a sprained finger versus chronic low back pain, it's so different. It's completely different. You cannot even compare that. And you might see that person with a sprained finger once, maybe twice. And then you might see a chronic low back maybe 20 times. And you might see them 20 times over a space of 2 years if you're doing the right thing like you and I do, when we're obviously doing the pain education, tolerating strategies, the loading, blah, blah, blah. But you cannot compare client to client and KPIs. Do you agree? Or do you think it's a warped sense of reality?
Yes, absolutely. And I think a caveat to this is, I am no business coach. I am no expert when it comes to the franchise model of private practice. I know there's plenty of people out there, and I agree with some points. I disagree with many, but again, I can't really speak for that side of the thing. All I care about is, how can I help the person in front of me? If I drop dead tomorrow and they have a plan, I've done my job. So they don't need to depend on me. If they want to see me for the guidance, the accountability, the support, I can definitely help them. If they think that they need me, so classic example, queuing, overcoaching.
Yes,
So
let's talk about this. This was a question I had anyway. Let's do it. Keep going.
So the idea is, just as someone's hands can create that dependency and reliance, not always, but as mentioned, if people think that they need it for pain relief, then they're going to expect it next time. So if someone goes into a personal training session, an exercise physiology session, an S&C coach training, and they do 15 minutes of foam rolling and specific glute activations before they get under a bar, before they do an actual warm-up, number one, what message is that sending to the client? What are they leading the session with? What's their idea of what a training session should be like? Number two, does that mean that they need to do that? What if they can't get a foam roller one day? What if they can't do their voodoo flossing because they left their voodoo floss at home and it's the day before a competition? What kind of message, we're creating fragility.
Agreed.
These are athletes that can adapt, they're resilient, and we're making them do low level activities based on some narrative from the 90s that fits our bias and that maybe makes the session last for 60 minutes, which makes, more money. But what kind of things are they leading with? So the overcoaching paradigm, just as we can make someone rely on our hands, we can make someone rely on our overcueing, our overcoaching, our unnecessary warm-ups. There's probably 3 rabbit holes we can dive into
Oh,
there.
we could go through a lot of rabbit holes there. I completely agree. I think a lot of strength coaches, physios, EPs, they overcoach things, and there's all these cues. And, you know, I think often one tiny cue is all you need. And often it doesn't need to be a hard cue, as in it doesn't need to be a complex cue. It doesn't need to be activate your glutes while you do this. It's not switch your core on before you do this. With a squat, it's like hover above a dirty toilet seat and don't touch it. Boom, that resonates in the client's mind. And they're like, oh, I do that every day. Well, that's pretty easy to understand. You know, and I think that you should really streamline your cues and give less. And I'll put it into this context. This is a really good way to put it. If you were ever coaching someone to kick a football or hit a golf ball, with a golf club, you would never give them 3 things to think about. If you give them 3 things to think about, the performance will drop. They'll get confused. They won't know what to work on. The best coaches give small pieces of advice and little nuggets for someone to get better at what they're trying to do. I even had a golf lesson on Saturday. So I love golf. And my coach, Christian, I've actually coached him in the past while he was chasing getting to the Australian Open last year. He coaches out of Bonnie Doon. If anyone wants a golf lesson, Christian's great. Christian's small. And he has given me one thing to work on. There's literally one thing. That's it. There's one cue. And I knew that I probably needed to do that, but he's just reinforced it. And what it's done is given me that clarity of being like, okay, I'm on the right track. I just need to do one thing for the next month, and that will most likely improve my performance. Much like a strength coach. If they're struggling with a squat or something like that, and they're just missing the mark a tiny bit, they might only need one little cue. So it really frustrates me. And that the intrinsic cues piss me off as well that physios use and EPs, you know, switch on your core, switch on your glutes. And like you go to a Pilates studio and that narrative's getting thrown around everywhere. Switch on your core, switch on your core. I'm like, well, do you need to? Would you agree with all of that massive rant of mine?
Of course, mate. It ticks all my biases. The idea is if we're trying to get people to do a movement with competence, we should be coaching them so that they're focusing on the environment and the external stimulus versus an internal stimulus, because they could absolutely overthink. Like you wouldn't look at a pro level golfer about to go through a swing and they're not thinking about 30 things at once.
No,
they're doing it. Just like when we're driving around, we're not thinking about our muscles as we switch gears or turn the steering wheel. We're just reacting to the environment, and that helps us then respond to the environment. So important in sports, right? When there's other factors involved and there's other players now, we have to respond and react that way. So we're building them towards unconscious competence or subconscious competence, and away from consciously having to think about every little muscle and particular feature of each movement. It decreases performance. It's been shown in the literature. So if we can get people away from thinking that they are sounding smart by naming muscles,
yes,
into just making the movement a lot easier for the person and letting them explore things, maybe facilitating the environment. So if say a squat depth is needed, maybe having a target like a box squat when someone's starting off, that just, fixes the whole thing. We don't have to say anything. So the less that we have to say, the more that we can facilitate their own learning, the better the motor learning effect and the better the performance.
Yeah, and it can be something so simple. And analogies are really good. I like to use analogies, and even with kids and adolescents, I use really simple analogies. Like if, say, for instance, I've got an adolescent, he's 13 or she's 13, you would probably not get too complex with a 13-year-old, and you'd probably make it fun. Like if I've got a netballer and we're doing, say, a broad jump or a triple broad jump or something like that, the analogy of, say, jumping over a river that's full of crocodiles or something like that. Do you know what I mean? Something fun. They're like, oh shit, I'm jumping over a heap of crocodiles here. And the further I jump, the further away from the crocodiles I'm jumping. Well, that's going to click in their mind, and just giving that one little cue will probably improve performance.
Yeah,
So
that's it.
I like to use just really simple stuff, and people often come and train with me and they're like, "Oh, you didn't really give me many technique cues." I'm like, "Because I didn't need to. Your technique's great." Like often it's little things like explode. When you get to the bottom of this lift, say a squat, I want you to explode. Or when you're doing a depth jump or something like that, short contact time. And I might not say short contact time. I'll just say hit the ground and explode. Something so simple. Or if it's a basketball, I want you to hit the ground and you're going to do the best dunk you can. Something so simple is so important. It reminds me, I need to repost this Instagram I've done, the intrinsic versus extrinsic cueing. We just need to get away from those intrinsic cues like the core and the glutes and this and that, and you should feel everything. Like when I did a session this morning at my prison gym and I was benching and I had 95 kilos on the bar. Do you think I'm thinking about, switch my core on, switch my pecs on? Oh, geez, I can feel my pecs. No, I'm just thinking about getting that bar off my bloody chest. So I think we need to get away from that. And I completely agree with what you've said. And it sounds like you agree with me.
Pretty much. I'm trying to poke holes at it at the moment, but no, absolutely. It's another great one is if you've seen The Exorcist or The Ring.
Yep.
You know, that arch, the girl
Oh,
goes
yeah.
into that crazy arch. So
Yeah.
I use that all the time with bench press, and people are like,
Yeah.
they laugh, it builds a bit of rapport, and they're like, oh, okay. So like really arch it. You call that arching? Arch like The Exorcist, like right now.
Yeah,
Go all the way. So all these things can make it fun, make it relatable, and get them not focus so much on their bodies, which reduces their performance, but focus on the position. And if you're in the right position, you'll feel the right, whatever the right muscles are. It's an arbitrary kind of idea. We're doing the task. So we're focusing our attention on the task. We're not going to think about, our TFL and our, quadratus lumborum when we have 100 kilos on our back doing a, heavy back squat, 1 RM. Fuck that. We're trying to, smash the bar up to the ceiling.
Yeah, completely agree. There's this great book by David Alred. Have you read it? Called The Pressure Principle. And he's coached people like Johnny Wilkinson and a lot of athletes. And he talks a lot about the extrinsic cues. He would rarely give an intrinsic cue to an athlete. And he gave this great example, which I love because it's golf. And he said that he wanted to reduce the height of a shot with a client. So he wasn't even a very good golfer. He was about a 15, 20 handicapper. And he was working with this guy, and the guy wanted to learn how to hit the ball a little bit lower. So he was given these cues by golf coaches that were very intrinsic, feel this, feel that. And all that Dave did was put a pool noodle in front of where he was hitting it. And he told the bloke, all I want you to do is hit it under the pool noodle. Automatically, it reduced the height of the shot. It came out flatter and it came out with more penetration. And then he got it because he gave him that external cue. He's like, well, if I don't hit it under the pool noodle, I've got to figure it out somehow, rather than being like it's a feeling. Obviously, eventually, once you start to achieve something like that, it then becomes a feeling. And with coaching and any sport, it becomes something that you feel, because you've done it time and time again. But you need to do it once to figure it out. And then you got to do it multiple times from there to actually ingrain it to the point where it becomes a feel rather than something that you're just doing because you've got an implement there or whatever. So
yeah, that goes to the value of the external cue. If there's a target or a barrier. So great example of just hit the backboard in basketball versus think of your wrist. So you're going to likely perform worse if you're thinking about your body versus just thinking about the environment. Another great one is touching cones in front of you as you land. So that automatically gets into the hips back position, the hip flexion. Yeah. So looking at, say, hurdles for running, if step rates are one of the things that you want to work on. So all these ways, how can we manipulate the environment? Say putting a dumbbell in front of the bar when someone's doing a deadlift so they don't swing it too far forward. These things.
I've seen you do that. It's a really, really nice little trick that you use. And I like that. I really do, because it's an external thing. And immediately that'll improve the bar path straight away. And I think the other thing that's definitely helped me in my career is the amount of sports coaching I've done. I've coached a bit of cricket over the years. I've coached a lot of Aussie rules, done a little bit of sort of golf and tennis as well here and there. And Tiger Woods has said it before. When he was a kid, and I keep bringing it back to golf because I love golf. But anyway, when he was a kid, his dad told him something that was amazing in regards to learning how to putt. Because if you've got a 10-foot putt versus a 30-foot putt, and you're trying to explain that to a kid, how to obviously manipulate distance, it's really hard to do. But his dad told him to putt to the picture, as in when you look at the hole, you take a little picture in your mind. Putt to the picture, putt to the picture. And he gets that. He takes the little picture and he's like, right, I'm going to putt to that picture, rather than thinking, okay, it's a 10-foot putt versus an 18-foot putt. I need to do this type of swing. It's more of a feel, and that becomes something that's ingrained, and he still uses it. He said he still putts to the picture. It's such a simple little cue. And this is a guy that's one of the greatest golfers, if not the greatest of all time. And he's still using such a simple cue. So simple is good. I like simple, and you sound like you like simple as well. And I love that on your Instagram. I've seen that many times where you're doing a deadlift and you put a dumbbell in front just to make sure people aren't sliding the bar too far forwards and the bar path is reasonably vertical. So you're all over that. Now, the other thing that I wanted to discuss when you said we could go down a rabbit hole, warm-ups. This really pisses me off, and I was literally just writing an Instagram rant. It's been a while since I did an Instagram rant, so I was doing an Instagram rant the last few days about warm-ups. It pisses me off that people are doing crazy long warm-ups, and there's all these Instagram influencers. Often what they do is they're like, check out my new injury-proof warm-up that's going to make you a better bench presser or make you a better squatter. Just talk to the listeners about what you should do for warm-ups and why these crazy long warm-ups are just kind of nearly a waste of time.
So the best warm-up for a squat is a squat.
Agreed.
So if we're trying to get someone to warm up for a task, why not just do the task? Like, why do they need to start with the low load specific exercises unless they enjoy it? I guess unless they have the time. I feel maybe some athletes, if they don't want to do anything else during the day and their life is just revolving around the gym, maybe then. But why would you go through that process of making someone waste their energy and looking at the utility cost? Like, what else could they be doing? Could they just be doing more training as well, instead of wasting their time with specific, I don't even know what you call them, just activation exercises before loading at all? So the idea is that with a warm-up, make it specific, the SAID principle here, make it specific to the task. If it's a team sports, absolutely, we need to do some jogging. We need to do some agility work. We need to pass the ball around. We need to get some team activity, like a small-sided game. What all the professionals do. So when it comes to a gym exercise, if you haven't been lying immobile for the whole day and you just stood up, you're next to a gym, maybe some walking, maybe some general cardiovascular, just circulation work for 5 minutes, and then just start loading. So that you're practicing the skill itself, you're getting some training time, and you're warming up specifically for that movement. There's no better exercise than the exercise itself. There's a great video by Quinn Hennick from Clinical Athlete on front rack mobility for a front squat. And he says the same things. Sometimes the best mobility exercise for a front rack position is the front rack itself. Just get into that position, load it up, get into the right position that you want, the most efficient position for you and your structure and your goals, and just do that. Like, it's so simple, but we want to complicate it because we want to feel like we know a lot. Yeah. And we want to feel like we can sell something that's special, and we want to differentiate ourselves from people. I think nowadays you can differentiate yourself by being simple because everyone out there is so complex.
Completely agree. Yeah, I think it's just overdone, and warm-ups need to be simplified. And I talk about it a lot. You just need to do warm-up or ramp-up sets. If you're benching, 3 by 10 for 80 kilos that day, well, you could do a few push-ups, and then you go, say, 4 reps of, say, 50, 4 reps of 60, 4 reps of, 70, 75, and then bang, you're into your working sets. You're ready to go. Have you done any crazy activation techniques? Have you got on the seated row and you've activated your lats, bro? Probably not. And there's a few notable strength coaches that I see do this. Check out my super duper warm-up. it's going to make your bench press better and you're going to get more volume and all this. I'm like, is it really? And yeah, it might be applicable to a power lifter that's trying to get that extra 0.2% change in weight or whatever, so he becomes a world-class power lifter. But is it, or would they just be better off getting a little bit better with, say, technique, optimizing their recovery and their nutrition a little bit more? You know, I just think that everyone's just trying to sell something these days. And it's the same thing with warm-ups. And even just things like, oh, check out my new, you know, booty band blaster. It's going to fire your glutes up. I'm like, well, is it any different than what he posted 3 months ago in terms of what he's trying to achieve? Do you know what I mean? Yeah, I completely agree. And I just normally use this as a bit of a sort of a framework. You can go 2 to 5 minutes of a bit of cardio if you want, but that might include just a bit of a walk to the gym. That might be literally you the walk to the gym at a reasonably fast pace from your car into the gym. And then you might do 5 minutes of mobility and movement that's effectively the same thing that you're about to do. So that might be some squats and some lunges and some hip thrusts. You might do some bodyweight squats, some lunges that are bodyweight. You might do some single leg bridges. You're getting some blood flow into the muscle. You're neurologically getting ready as well. And then you do some ramp up warm up sets for that first exercise, e.g. your squat. And then you're ready. And then bang, you do your working sets. And then at the end of your session, you can do some other stuff if you want, some mobility stuff if you're crazy, if you want to, some stretching if you want to, but you don't have to. Would you agree with a similar structure?
Yeah. And so we're thinking of the principle of the big rocks. So what are the big rocks for someone's program? If they're going to have a strength and conditioning program, would you start with their, accessories and the small muscles and the isolation style movements, or would you just go into the compound straight away so they have the energy for performance and they're looking at that as a way of tracking their performance over time? Then you can add on the sprinkles on top, the small rocks at the end. So once someone is warmed up with their specific warm up for their activity, say a squat, a bench, or a deadlift, then they can sprinkle on top the accessories afterwards. So even if we're looking at it from a performance standpoint for a powerlifter, you don't see a powerlifter do accessories before their big three. You don't see them fatigue themselves before getting under a bar. And if you do, maybe there's some questions that can be asked for that person, for that athlete. And where did that come from? Like, who told them to do that? And where did they get that information from? So if we're looking at the idea of building up motor learning, external cues are better. We're looking at creating a facilitative, supportive environment, positive expectation. We're looking at so building up tasks and skills, fitness specific to the movement. So the STED principles in there, progressive overloads in there, maybe looking at, like you said, their recovery. Once that is done, then you can sprinkle on top whatever the person likes, whatever makes them feel good. Maybe some variety at the end for a bit of fun, cross-training, absolutely. But yeah, like you said, stick it to the basics.
Yeah, completely agree. I often use the analogy of building a cake when I'm talking to a client. You know, the icing on the top of the cake might be some, specific core things that they want to do or something like that. And then the sprinkles might be, I want to do a bit more banded stuff at the end just because I want my glutes to burn a little bit at the end. Do you know what I mean? Like, the fundamental principles are always the same to build that cake, and you don't have to overcomplicate it. One thing I will say with warm-ups is we're talking more about strength training warm-ups here, and you even mentioned it yourself. If you're going and playing a change of direction sport or a running sport or something like that, specific warm-ups have been shown to help reduce the potential risk of injury, e.g. the FIFA 11 Plus, the PEP program, the AFL First, the netball one. These warm-ups are very important for athletes that are doing that. But again, they don't need to be very long. But I do like them. I do like the FIFA and these type of movements because it gives a bit of structure to a lot of team sports. I think, get to training, and rather than just kicking the footy for 2 minutes and then jumping into some game simulation, we're warming up properly. I think that's important to understand. Is we're talking about, in terms of the warm up here, it's more of the strength type of warm up, strength training type of warm up, rather than obviously change of direction running sports. Agreed?
Yep, 100%. That's it. And maybe we can look at training in specifically for the athletes versus just focusing on the warm up. Because if you just do, okay, this is the only time ever that you're doing these movements, maybe then you're missing out on some gains that they can get in the gym. So if there's evidence for doing these movements, we can train them as well as warm up with them. So yeah, absolutely agree though. If it's a change of direction sport, if there's other factors involved in that task, you need to prepare for that task.
Yeah, I agree. And you can make things fun as well in a warm up. I think people make things too rigid, like little things, if I've often got an adolescent kid, if we're doing some change of direction work or some agility work, I'll make it fun. Like if I've got a 10-year-old and they're doing some change of direction stuff, rather than doing a structured change of direction drill, throw some cones out or some tennis balls out and just say, you got to go get every single cone and put it in this basket as fast as you can. They're picking stuff up off the ground. Like that's really good for an Aussie rules footballer. They're picking stuff up off the ground. They're coming back. They're trying to do as quickly as possible. They're changing direction. They've got the agility side of things. They've got, and you could even do it with two of them in there. You've obviously got the side-to-side movement. You've got the acceleration, deceleration. I love stuff like that. Keep it simple. Make things fun, especially for kids and adolescents because they'll get bored. One more question for you, mate. Give me some advice that you would give to other exercise physiologists, personal trainers, and physios, especially when they're early on in their career.
I think the first thing is to think critically. So question everything, even question all the claims that you and I made, question the way we practice, question everything that we've been taught. So we're looking at improving our ability to think critically. So we don't just take things for face value. We don't just take things because an authority figure, a guru told us. There's so many factors involved in treatment outcomes, in helping people, non-specific, placebo, contextual effects, regression to the mean. You mentioned natural history. All these things are at play. It's complex, very, very complex. So the first thing I think is to question everything, and that builds us a sense of curiosity. Because if we're curious, we're going to keep learning, and we're lifelong learners. So everything that I said today, I am more than willing to drop with the body of literature as there's more and more evidence, either disconfirming or confirming, so that we become less and less wrong. But the first step is to question everything that we do. I think that's the most important. The second one would be get some experience. So I think you harp on it about getting some coaching experience from the start. So we're working with humans. We're learning how to interact. We're learning all the interpersonal communication skills. And we're also able to coach and experience some movements ourselves. So if we exercise ourselves, we kind of had an understanding of what we should be feeling. We have an interoception. We have proprioception as well. We have a skill then that can create that buy-in, especially for athletes. If the athlete can look at their physio, EP, S&C coach, perform a movement and perform it with competence, automatic buy-in. I think that's a skill that uni definitely does not teach. So if you can grab some mentoring, some coaching yourself, it can be according to your biases, to your sports, to your preference, whatever that movement goal might be. I think the process of going through that ourselves as clients, as athletes, that will teach us so much to become better at coaching it.
Yeah, I completely agree, mate. Great advice. And if anyone isn't following Daniel on social media, get to it. Really good platform, especially you young physios, EPs, personal trainers. Get on there, especially the Facebook. I think the Facebook, you've got more scope to, I think, go longer with a lot of the posts that you do. And I think you're a little bit more active on there potentially. So yeah, get on his Facebook, check it out. And this is a good segue. Where can we find you, mate, in terms of Instagram, Facebook, website, all that sort of stuff?
Yep. So website is coming up very shortly, actually. So I've just ventured out into my own business. I am in the city in Sydney, if anyone is around. I am most active, as you said, on Facebook. So Arbilla Exercise Physiology. Also on Instagram, where I post some client examples and that cue that we use about deadlifts, it's all on there. Also a mentor and educator with the Knowledge Exchange. We run continuing education courses around communication skills, pain science, motivational interviewing, and the coaching mindset, going away from that fixer over-reliance on our modalities into more building and empowering self-efficacy and getting people to self-manage. So that's the Knowledge Exchange. We're on Instagram and Facebook. There's a discussion group that we can get some spicy discussions and debates on there. So do check us out. And yeah, happy for anyone of the listeners to reach out with any questions. Happy to help.
And there's the Knowledge Exchange podcast as well.
There is the Knowledge Exchange podcast, yes, on Spotify. I almost went into my spiel that I get in. This is the Knowledge Exchange podcast. Welcome. I'm your host, Daniel. So yeah, check that out on Spotify. I believe it's on Apple Play. I should probably know this. And yeah, so tkex.org is the website. So check us out if you're keen to dive into some more communication skills and pain science info.
I have featured on the podcast, and it's a great podcast, so I highly recommend it to all listeners. You can find me at wildphysiofitness.com.au and Wild Physio Fitness on all socials. You can find this podcast, Wild Physio Podcast, on Apple Podcasts and Spotify. Any last thoughts or words of wisdom, Daniel?
I think question every single post and look at the caveats and the nuance. So just because you see a post and you get that initial visceral reaction of like, screw this guy, I hate this guy, and how dare he attack who I am and what I do, just be able to take a step back and look at it objectively. And yes, it might not be helpful, it might not be useful, but at least you had that ability to step back from your modality and your intervention, because that skill, if you have that skill, you will go places.
Great advice. Thanks again, mate. It's been a lot of fun, and you're a wealth of knowledge. So thank you very much, and we'll have to definitely do it again. And I hope everything's going well in the first week at the new business. It's exciting. Congratulations.
Thanks, mate. And pleasure to stay in touch with you as well, and keen to keep the conversation going.
Sounds good, mate. Let's chat soon. And as usual, guys, stay strong.